Hey, it's April 14th, and this is your COVID-19 news update. Today, Ontario's state of emergency was extended by another month, but the province's health officials said that they're expecting the first wave of COVID-19 cases to peak this week and for the number of cases to slowly start going down after that. Also today, Justin Trudeau said the federal government is talking to the provinces about lifting economic restrictions, but that it's still going to be weeks before that happens, that we'll have to ease into it and stay vigilant until a vaccine comes. And south of the border, the U.S. surpassed Italy over the weekend as the country with the highest number of coronavirus deaths, recording more than 20,000 deaths since the start of the outbreak. Okay, on to today's episode. So police forces across Canada have been given unprecedented new powers in the context of this pandemic. And they're cracking down on people who are breaking social distancing rules. Within just the last few weeks, hundreds of people have been fined or charged for gathering in big groups or for being out in certain public spaces. And for a lot of us, it's still a bit jarring to see this many cops on the street and to have to interact with them so regularly. But this isn't the first time we've seen cops be involved in trying to stop the spread of a virus. It still happens with the criminalization of HIV. And our guest today says there are a lot of important lessons we can learn from that. Today on the show, I'm talking to Alex McLelland. He's a researcher at the University of Ottawa who recently started tracking police enforcement related to COVID-19. And as someone who lives with HIV and has to contend with its criminalization, he's concerned about what can happen when you involve police and public health issues. I'm Tamara Kendacker, and you're listening to Wait, There's More. Alex, hi. Thanks so much for doing this.
Thanks for having me.
So we've seen over the course of the last few weeks, few months, a massive expansion of police powers given to police by various governments to enforce emergency legislation and protocols to slow the spread of COVID-19. So provinces have had to shut down non-essential businesses, impose physical distancing rules, mandate self-isolation, that sort of thing. And violating some of this stuff is now punishable by fines and even jail time. And I was wondering if we could start by talking about what you've seen across the country in terms of new police powers. Can you just kind of paint a picture for me?
So it differs in different places, but it's also quite similar in terms of how it's manifesting. So in every province across Canada and territory, states of emergency have been enacted. And in some places, municipalities have enacted emergencies and as a result have various bylaws specifically regulating social distancing, gatherings of people, and so on.
Police confirmed to Global News that they handed out a over $700 fine to a man who was gathering with 25 other people in a parking lot Sunday night.
So we have kind of a whole bunch of different acts that have been enacted or laws that have been enacted that also allow for a ramped up police presence and police monitoring and enforcement of what's going on. Police have also been given the power, and as well as bylaw officers in certain places, to enforce emergency legislation and public health legislation. They hadn't previously had access to do that. So this is kind of a scaling up of their power.
If you're not practicing physical distancing, police in Ontario now have the authority to hand you a hefty fine.
They receive a set fine with the victim surcharge and the court cost of $880.
In places also, collective agreements of police have been altered or suspended briefly so that police can work overtime, more police are on the streets. And now the federal government has said that the RCMP is going to be enforcing and coordinating police forces across the country, enforcing the Federal Quarantine Act. So we also see federal law in play in relation to this.
When you're issued an order from the federal government on the Quarantine Act, we expect that to be followed. Our peace officers who are designated under the Quarantine Act can then take necessary measures. And the Quarantine Act has very powerful penalties.
So we haven't necessarily seen the Quarantine Act be enforced yet, but the RCMP announced that they're going to be enforcing the Quarantine Act. Right now, what has been enforced across the country is provincial legislation or municipal legislation, new bylaws that have been enacted around social distancing. So in Ontario, bylaw officers are now empowered to ask for people's ID if they feel that someone is violating public health protocols. So there's a whole massive scale up across the country in terms of new police power.
Okay, so in order to enforce these rules, police are able to ID people, like you just mentioned, to arrest people, to fine people, all sorts of things.
To seize vehicles, to arrest people, to fine people. Yes, exactly.
You wrote in this piece for Now that you're also seeing evidence of people turning on each other, that the crowdsourcing of policing is being encouraged with these snitch lines that are popping up across the country. Tell me a bit more about that.
Yeah, so it seems like in many jurisdictions and municipalities and provinces, there are snitch lines popping up all over the place. So in Montreal, there's now billboards with the snitch line number to call the police. In certain municipalities, there's big ads in the newspaper for people to call and report on each other. So there's been this culture of snitching, the crowdsourcing of policing, getting people in each other's communities to report on each other to see so-and-so is violating these rules. I'm going to call the cops on them. And so police have been reporting that they've been extremely successful.
The Montreal police continue to get calls from concerned residents sounding the alarm about gatherings.
The calls that we're getting, what's encouraging, it shows that there is social awareness and people are getting the message.
Thousands and thousands of people have been calling into different lines in different cities across Canada, reporting on their neighbors around supposed violations or alleged violations, which I think is creating like a context of kind of panic and suspicion in a context where people are already scared.
Yeah. So how is this all playing out so far? Do we know much about how often police are enforcing these rules? I've seen news stories here and there, but do we have much of an overall sense of how much these rules are being enforced by cops?
Yeah, so I've been working on this project with my colleague, Alex Lubscomb, who's a PhD student at the University of Ottawa in the criminology department there. And so we've developed this map where we've been trying to document the various places where enforcement is happening across the country, called policingthepandemic.ca. And we just released a enforcement report looking at what we know. And this is relying on media reporting, and also in many places, police are also communicating through social media on their social media pages how many people they've arrested, or how many charges have been laid, or how many fines have been levied, and that sort of thing. Since April 4th, which is when our project started, we've documented over 700 instances of police enforcement, a majority of which are tickets around social distancing. We've also seen 29 criminal charges, a bunch of businesses that have been fined for being non-essential businesses. And so it is happening quite systematically across the country. A number of provinces just recently gave the powers of police to enforce these emergency acts or public health acts. So we haven't seen, as in certain provinces, a scale up like we have seen in Ontario, Quebec, and Nova Scotia, which have had a majority of the tickets or public health violations, alleged violations. So there's been quite a few across the country, hundreds, in fact.
Okay, and are there any trends that have emerged from this, or any examples that stand out to you as problematic or concerning?
Well, in many instances, the laws that have been put in place, the first offense would be maybe $1,000. The second offense is $3,000. The third offense leads to jail time. So near James Bay, there's a Cree community in northern Quebec where we've seen multiple moments of enforcement against Indigenous people for home gatherings. We don't know the specifics of those, but the police force there has reported them and indicated that people have already received a number of violations. So right there, you could see the outcome could be jail time in this Indigenous community, and we don't necessarily know what's going on, why people are being alleged to have social gatherings. Ontario, Quebec, and Nova Scotia were the first ones to start enforcement, and so we're expecting to see more. But so far, we've seen a trend that Quebec has the highest level of incidents of enforcement. The majority of those are in relation to alleged violations of social distancing. Then we're seeing a very small number of incidents related to people coughing or spitting, primarily in the context of an arrest by police. So like someone was caught in a vacant building that wasn't theirs. Police intervened and arrested the person. The person coughed on the police saying they had COVID, and they're being charged with breaking and entering and assaulting a police officer and uttering threats. So we see a number of cases like that popping up across the country. And that just seems to me like another way, or police adding charges on top of other charges, another way to kind of punish someone. In those instances, there's been no allegation of the person actually having COVID. So far, no threat that COVID has been transmitted in those instances. But overall, a majority of the charges that we've seen are in relation to not social distancing or gatherings of groups of 2 or more people.
We'll be right back. We've never seen anything like this pandemic in our lifetimes, but you've written about how this is not the first time public health officials have cooperated with police, and I wanted to talk about that briefly with you. Why did you decide to take this project on, and where have we seen this kind of cooperation between the police and public health officials in the past?
I have studied the criminalization of HIV, specifically looking at people in Canada who had been alleged to not tell other people that they had sex with that they had HIV. And in Canada, we're known around the world as a leading country for criminalizing people in those instances. And it's an approach that the United Nations says is the wrong approach. It's an approach that public health officials say is the wrong approach, but yet Canada continues to do it.
Under Canadian law, people living with HIV must disclose that information before engaging in any sexual behavior where there is a realistic possibility the virus could be transmitted. To not do so is a criminal offense.
And it's an approach that also has had only a negative impact on the AIDS pandemic. And in Canada, we've seen no decrease, for example, in HIV transmissions because of policing the virus and putting people in jail in relation to having it. The idea that circulates around people living with HIV is that they're going out into the world trying to spread the virus. But when you actually talk to people, you realize that that's completely different. And for example, one Indigenous woman that I spoke to, she tried to tell her partner but didn't know how. She was super depressed, didn't have the skills to talk about sex with her partner, and there was a power differential in the relationship. She handed him a condom, which is her way of disclosing. He didn't use the condom because of the power in the relationship. She is now a registered sex offender, and she spent multiple years in jail. And so this is how Canada deals with managing communicable diseases through the criminal justice system. And it's a blunt instrument that forces complex situations into boxes of victim and perpetrator, into right and wrong. And so policing of COVID is going to do the same thing. I'm fearful in terms of like not understanding complex situations or why certain people might be considered to be violating public health protocols. There might be more complicated reasons as to why they are, and intervening with the police is not going to give us a solution.
Okay, and I do want to talk about that, but the way that the expansion of police powers is being justified here is that it's about enforcing the rules to help stop the spread of COVID-19. So why has policing and criminalizing not worked in the context of HIV in terms of decreasing transmission?
The two viruses are very different, obviously, and they're transmitted differently. But in relation to HIV, criminalizing the virus deters people and scares people from seeking healthcare and from getting tested for the virus. People are scared that if they know that they have HIV, that they could be arrested. There's a saying that goes around the community called "take the test, risk arrest." People's healthcare workers, nurses, and doctors have been compelled to testify against them in court. So people then are scared of going to healthcare professionals, talking to community-based organization workers or social workers for fear of having anything used against them. And so it creates a chill and deters people from accessing healthcare. And at the same time, it's a massive violation of human rights for people with the virus. I myself am living with HIV. I've lived with HIV my entire adult life, and I've never known a sexual experience in my life where I have not had the police or the criminal justice system in my head in terms of dictating how I can live my life. Many Canadians out there have not been in that experience. But in my experience, people living with a virus like HIV are not the problem. The criminal justice system is the thing that is going to bring harm, insecurity, and instability and human rights violations against people. The virus itself is not. Now that's for HIV. In COVID, it's a different context. We don't yet have a full understanding of how the virus works. But again, engaging with police in the context of a pandemic is going to further exacerbate the crisis.
So historically, criminalizing HIV has not worked, at least to slow the spread of the disease. But you've also written about how laws that are designed to punish people during the pandemic will disproportionately target marginalized communities. Why do you think that, and how did you sort of come to that conclusion?
Yeah, policing institutions in the criminal justice system do not target every Canadian equally. So, for example, in Ottawa during the policing blitz, there was a Black man in a park walking with his daughter, and a bylaw officer singled him out in the park, came up to him and demanded he say what his name was. He refused to say what his name was because he had suspicions of authority, and the bylaw officer punched him in the face. The park was full of other people. That Black man was targeted by enforcement officers because that's what happens across Canada, historically with police. And just a few weeks ago, we saw that police responding to a Black man in mental health crisis in Brampton ended up tasering him and shooting him. And this is one of a litany of instances where police have responded to a complex social situation with deadly force. And we've seen systematically across Canada racialized violence by police over and over and over again. And when they're deputized to engage with communicable diseases, they can act in even more violent ways. So we saw a couple of years ago, Toronto police tasering a Black man in downtown Toronto and said to an onlooker who was recording the incident, watch out, he has AIDS, he might spit on you. HIV cannot be transmitted through saliva. Every reasonable person knows that. Police are still mobilizing this outdated understanding of AIDS, of HIV, to instill fear, to instill panic, and they use communicable disease to justify the use of force. And so I think that's a concern when you look at the legacy of policing across Canada and how certain communities have been targeted or neglected by police.
And there's another point I wanted to raise and get your thoughts on, which is this idea of COVID-19 being this great equalizer and affecting everyone the same way. But we're already seeing that that's not the case, that certain communities are being hit harder than others.
Sure. Yeah. I mean, the people who have the luxury to stay home are people who have homes. So we saw already in Montreal and Hamilton, homeless people being ticketed. In Montreal, they received $1,500 tickets. In Hamilton, $880 tickets, ticketing homeless people for not being able to have a home to stay in. This is the epidemic response when you engage police or enforcement officers. We know that across Canada that COVID is already in shelters and is going to disproportionately impact homeless people. There are many people who work in the gig economy who are the frontline people in our keeping our society going. And those are working class people of color who don't have the access to resources to stay home. So people who are delivery workers, people who are working as checkout people, people who are working in kitchens, keeping food going for people. Those people don't have the luxury to stay home. So they're going to be at greater risk because of that. And they will also be the people out on the streets who could be targeted by police because of this ramp up of police power and more police on the streets, more enforcement officers on the streets. It's a perfect storm for exacerbating further marginalization of already targeted marginalized people by police.
And in the US, we're already seeing that the virus is hitting Black communities disproportionately.
So in the US, they're already finding in many Black communities that there's a greater impact in those communities. And Canada has said that they're not going to collect race-based statistics, which is shocking. So we won't even have a racialized understanding of how the virus is manifested.
You know, it's interesting to me that anecdotally there seems to be widespread support for policing and enforcement when it comes to COVID across the spectrum. Like, I'm seeing people calling on people to call the cops on each other, advocating for a police-enforced lockdown. There is this new Ipsos poll that suggests that a strong majority of Canadians would support strengthening measures like physical distancing that are already in place through fines, for example. So I guess what I'm wondering is, how do we strike the balance between enforcing public health measures like physical distancing, which we know are so crucial to slowing the spread of this virus, while making sure that marginalized people aren't being disproportionately targeted, that human rights are upheld? What's the middle ground here?
Well, policing is not going to bring an end to COVID. It's going to result in multiple fines and people going to jail and people with criminal charges, a disproportionate targeting of marginalized people who are already at greater risk at COVID. And another thing that I think people need to think about is that police, we're already seeing across the country, police are at a high risk for COVID. Many police forces have COVID infections in them, and some police forces have many COVID infections in them. These people are out in the streets and they are engaging with many people simultaneously throughout the day, and they're at a heightened risk for COVID. And we have anecdotal reports that police are not social distancing, they're not wearing PPE, and the ramp up of enforcement could be exacerbating the crisis and lead to greater infections. I think people should question what other things or what other options there are. And it's kind of, for me, it signals just a real lack of imagination in terms of how society could be organized in different ways. Why are we not ramping up as fast as possible testing everywhere? Why are we not ensuring that everyone has a basic minimum income so that they can have the supports they need to stay home? Why are homeless people still on the street and then receiving tickets for not social distancing in the context of a pandemic? Why have we not released buildings so that those people have a place to stay so that they can be safe? And why are we paying police salaries instead of paying for those things?
But I guess just in the context of like today, I think a lot of people would agree with you, right? A lot of people are having this internal struggle of being anti-snitching, being anti-police overreach. They don't like it. But then we see people who are not following the rules and they know that what they're doing is wrong and they don't seem to care. What advice would you have for people when they see that happening?
The Nova Scotia medical officer of health said, before you call the cops on someone, go check in on them. There might be reasons why that person is not able to social distance. There might be language issues. There might be mental health issues. There might be comprehension issues. They might need something. There might be a reason. So instead of calling the cops, go check in on people. There's many things people can do in their neighborhood to support each other, even though we're right now having to physical distance, as opposed to calling their cops on people. And we've seen a massive crisis in the US, for example, of white people calling the police and then police engaging in violent ways with people of color. And so it's extremely concerning to see a culture of snitching on each other, because those racist patterns of how policing operates are not all of a sudden vanished. When a pandemic hits, they're actually exacerbated. In terms of the thing of, there's certain people who are breaking the rules and who don't care. That happens always in society. So like, people still speed on the road. People still are drunk drivers. It's unfortunate. And people do put other people at risk for harm in some instances. And we do have to figure out ways to deal with that. And what I'm saying is that we need to reimagine society to respond in different ways to those problems, because responding with force only leads to human rights abuses.
BC's health officer, Bonnie Henry, was asked about this yesterday, about how to crack down on people who've been violating the rules. And she said, we need to make sure that people are aware of them.
And the vast majority of people are doing the right things, and that we need to give people the understanding and the means to do the right things. So rather than closing down beaches, I think we need to ensure that people are aware of the rules.
So what about the education piece? Is the government doing a good enough job of communicating what the rules are?
Yeah, I mean, we do need to do a much better job in terms of communicating and educating people about the rules. And I think putting resources into that instead of enforcement, I think, is key. Also, a lot of people don't understand the rules, or some of the rules are some people think they're going over the top.
Todd Nelson took his sons, Liam, Brandon, and Dustin, to the parking lot of the Glen Abbey Community Centre. But not long after, he says, a bylaw officer pulled up and told them they had to go.
The whole parking lot was completely empty, and I just said, well, who are we hurting? And he said, "Oh, you're not going to be like that, are you?" And I said, "I'm just asking a question." And then that was it. He just said, "Give me your ID." And next thing you know, we got a ticket.
Some of the tickets that were given out in Nova Scotia were for someone being in a park alone at night. And so I can see that person would be like, they are social distancing. Why does the entire park have to be closed if people can social distance? And so there are conversations, and in certain places in the US now, parks are being opened, and then there's rules around social distancing in public. Instead of closing every public space in a context of quarantine and ensuring having people lose it while being stuck in their houses, opening up public spaces in safe ways could happen. So I think certain people might be flouting the rules because they don't understand how those rules actually will impact the transmission or spread of COVID.
Yeah. So are you saying then you don't want to see police enforcing these rules? What would you rather see then? Do you think that it should be public health officials that are doing this? Do you have any thoughts on that?
Yeah, well, this is a crisis. So, and many people are working from home or not working anymore at all. But we have massive resources across Canada in terms of social workers, teachers who could be doing education. One woman was arrested in Quebec City for violating self-quarantine. She was arrested and put in jail for the night. She then violated again. And the reason why she violated is because she had comprehension issues and a mental health issue. She's now in custody, and she was initially arrested by police. What she needed is a mental health support worker to engage with her and support her to figure out how to social distance. She didn't need to be put in jail for the night and arrested by a police officer. There's been calls for not having police respond to mental health issues across Canada and having frontline social workers do that instead. And I think as a society, this is a moment where we can contend with more supportive ways to respond to social problems.
Alex, thank you so much. Really appreciate this.
Thank you for having me.
All right, that's the show. Thanks so much for listening. Just FYI, I have been reading your text messages. You guys have been sending in some really great and some really weird ideas, and we appreciate it. So keep them coming, along with any questions you might have about the coronavirus, and we'll try to answer those. I'm at 437-235-2849. I'm Tamara Kendacker, and I'll talk to you tomorrow.